in Jharkhand, we had the good fortune of having the scheme inaugurated by the Honorable Prime Minister here for a nationwide inauguration. And I think in the initial 4 months that we have implemented it, we have been fortunate in taking some good policy decisions early on. We had adopted the hybrid model where we do an insurance coverage of 1 lakh and the rest by directly paying through the society. And I think this has served us well in terms of the early adoption of the scheme, as well as quickly increasing the number of claims that are coming under the scheme. This is primarily because there is large capacity of implementing the insurance model in the insurance company rather than for the state, a greenfield state, to develop capacities in the first tranche itself. The second good thing that we had was of adopting the entire PDS database as our beneficiary set rather than doing it for SECC, because identification and utilization of that identification is much easier in a PDS database. This of course causes a greater revenue burden on us as the center only bears for the SECCA, but identification as well as messaging becomes much more easier for our beneficiaries in Jharkhand. A couple of issues. One is really the underdeveloped tertiary sector in the state itself. We feel this as more and more facilities come up in response to the scheme, Jharkhand will get better empaneled hospitals in the tertiary care sector. National portability needs to be augmented quite a bit so that patients who go out from Jharkhand for accessing care outside get cashless treatment properly in all the states that they go in the empaneled hospital network. The third challenge is getting our public systems to generate as much claims as possible so as to strengthen their own infrastructure and kind of upgrade their own facilities as well. We are now kind of focusing more on augmenting our quality standards in these hospitals, as well as trying to completely run a proper good IT system. So a lot of customizations are needed, and we have raised those issues at the center, and we expect that over the next couple of months all these issues will be sorted out and we'll have a flawless IT system in place.